And then for someone like me personally, I was told I had COVID, I'm pregnant, I should still, despite all of that, get the vaccine and get tested regularly, all of which you just sort of you just debunked and said that's not necessary. So let's talk about the risk factors. There's always risk factors that people have to weigh when it comes to any sort of vaccine, but particularly this one. And what are your thoughts on it being recommended to pregnant women in particular?
We know that the registrational trials that Pfizer, Moderna, Johnson & Johnson, and outside the United States, AstraZeneca performed had really strict criteria. The clinical trials were done correctly. And recall that the clinical trials delivered pretty good results, including 90% vaccine efficacy and acceptable safety. So the clinical trials were done the right way. And one of the reasons that made it come out so good is they properly excluded groups from the clinical trials, including pregnant women, women of childbearing potential, COVID recovered, and suspected COVID recovered patients. That was correct. We always have exclusion criteria for clinical trials based on principles where if we believe a group has an expectation of not benefiting from being in the clinical trial or an expectation that they're going to be harmed, they're excluded. So routinely, pregnant women are excluded from clinical trials because pregnancy is actually two patients. It's the mother and the baby. And so we must have a lot of supportive, assured, basically reassuring data before we would ever use a new product in a pregnant woman. For vaccines, the only vaccines that are allowed are the inactivated flu, pertussis, and the tetanus shot. That's it. So we never allow a live vaccine or even a live attenuated vaccine in a pregnant woman. And we would never allow a vaccine that has a dangerous mechanism of action into a pregnant woman's body. And what we know of the COVID-19 vaccines is they install genetic material that's carried on lipid nanoparticles into cells throughout the human body. We know now that the lipid nanoparticles install genetic material in the brain, in the heart, in the adrenal glands, the ovaries, the testes. This is now known. And there, the genetic material basically takes over cells' machinery, and the cells produce the spike protein, the dangerous protein on the surface of the virus. There's little spines that you see on the cartoon. Spike protein is 1,200 amino acids. It's got about a dozen glycosylation attachments. It is lethal to cells. It damages cells. It goes out in the body. It freely circulates. It damages blood vessels. It causes red blood cells to stick to one another, platelets to stick to one another. It causes blood clotting, and that blood clotting causes damage to organs like the brain, the heart, and elsewhere in the human body. So with that description, I can tell you that no reasonable doctor and no reasonable pharmaceutical company and no reasonable, governing body over doctors and public health would ever let a pregnant woman receive an injection of one of these COVID-19 vaccines. No good doctor would. And the FDA was correct in excluding pregnant women and women of childbearing potential from COVID-19 vaccination.
But yet they're still recommending them. And, I've also heard, you give data and talks, about how COVID-19 is, not really affecting children, but yet they're pushing forward with possibly mandating vaccines for them. Why do you think that there is such this big global effort and coordination behind all of these things?
You pick two populations. Let's take pregnant women first. Pregnancy is a natural, very strongly immune state. Pregnant women have some of the best immunity you can find in human medicine. You know this because as the baby moves through the birth canal, there's actually a tremendous exposure to bacteria in the bloodstream, and pregnant women do fine. It's basically a God-given miracle to deliver a healthy baby and having a wonderful family start from there. And it is a super immune state. So pregnancy is not an immune deficient state. And in a paper published in the Annals of Internal Medicine by Pinellas and colleagues, pregnant women have a better COVID-19 outcome than non-pregnant women. So we don't have any concern with pregnant women. Now, there are some pregnant women who get COVID-19, the respiratory illness, and they have severe symptoms, or they may have risk factors like obesity or diabetes. They may have intrinsic lung disease. And so we are skilled in treating pregnant women. Pregnant women have received monoclonal antibodies, the Regeneron, the Lilly, or the GlaxoSmithKline product. They weren't tested in clinical trials, but we don't have reason to believe the monoclonal antibodies would be dangerous. We can clearly use hydroxychloroquine, which is modestly effective. Hydroxychloroquine is routinely used in pregnant women who have systemic lupus erythematosus. There's been studies of hydroxychloroquine in pregnancy. It's perfectly safe for the mom and the baby. So we can clearly use hydroxychloroquine. We don't have such supportive data for ivermectin or favipiravir, and we don't have data for the new Pfizer drug, nalfiprinir, combined with ritonavir or with molnupiravir, which is the Merck drug. But we have data with azithromycin, which we had used in our protocols. That's fine. Inhaled budesonide is fine. Oral prednisone is fine. Aspirin in pregnant women is fine. In fact, it's used in preeclampsia anyway. And then there are circumstances where we may need to use blood thinners in pregnant women. But I can tell you, I'm very confident that skilled doctors can treat pregnant women with COVID-19 and deliver them through the illness and without any threat to the woman or the baby. The only women that I'm aware of with pregnancy that's actually had a bad outcome or fatal outcome are sadly those who are denied treatment. They are denied treatment by clinics and hospitals. And it's a shame. Now, the guidelines bodies, the American College of Obstetrics and Gynecology is actually officially recommending that pregnant women actually take the COVID-19 vaccines. And that means they're recommending them to go into research against their will. So remember, the COVID-19 vaccines are research. None of them are FDA approved. The consent forms always say it's experimental or research. So never have we had an official body, the American College of Obstetrics, basically provide a recommendation that women be conscripted into research with a vaccine that doesn't have any proven safety in pregnant women. In fact, there's only one paper. The first author is Shimbawako, and this was published in the New England Journal of Medicine, and it involved about 3,000 pregnant women. And in that paper, they did take the COVID-19 vaccine. It's ill-advised in my view, but they went ahead and did it as part of the public program, and things were basically chronicled. There was great controversy in what happened in the first trimester. The first trimester fetal loss rates could have been as low as 12%, but depending on what denominator was used, because not for the full course of 9 months, that fetal loss rate could have been as high as 83%. Cool. So there's a huge range, and there was a ton of letters to the editor that came in, people basically making claims one way or the other that it was safe or grossly unsafe. In the end, the authors retracted their conclusions and simply said, we don't know if it's safe or not in pregnancy. We simply don't know, and that more research is needed. I was leading a group with Canadian authorities, Deanna McLeod, and as well as Dr. Ray Stricker from University of California, San Francisco. Ray leads the largest fetal loss program in the United States, and we published our analysis in Trial Site News, and we concluded that for pregnancy, the COVID-19 vaccines are category X, meaning under no circumstances should they be used. X means don't use it because there is a dangerous mechanism of action, and we have great concerns. And I want to provide the exact citation for the only pregnancy paper. And the first author is Tom Shimabukuro, and the senior author is Dana Meany-Delman, and this is for the CDC VSafe COVID-19 pregnancy registry team. This paper, published in the New England Journal of Medicine, April 21st issue, in many ways is representative of the great confusion and the concern we have about vaccination in pregnant women. So I can tell you, as a doctor of, I'm in a position of authority in the United States to make this call. I'm telling your listeners, pregnancy category X, and it's off limits.
And you talked about in there how you've seen, pregnant women bouncing back from this and from COVID. I myself got COVID at the beginning of my pregnancy. Was fine afterward. Baby's on track, doing great. Can we make any conclusions yet on what sort of natural immunity I might pass along to the baby?
There are data suggesting you will pass along the antibodies against the spike protein in the nucleocapsid to the baby, but we don't know yet now whether or not the baby would immune. Now, remember, babies have little or no symptoms of COVID-19. It would be a runny nose that you wouldn't be able to detect anyway. So children don't have any significant symptoms with COVID-19. We know that from the registrational trials. We know in the paper by Walther and colleagues, New England Journal of Medicine, where they tested Pfizer 10 micrograms at baseline and then 10 micrograms 3 weeks later. And then in a paper by Frank and colleagues, New England Journal of Medicine, ages 12 to 17, where they used the full 30 micrograms dose of Pfizer. That's 4,500 patients in these two trials. Do you know there was less than 24 kids who got viral upper respiratory symptoms with COVID-19? And it wasn't 100% effective, but there was no spread, no mention of spread, no serious illness. It would be like, it's indistinguishable from one of the other 4 colds these kids have a year. Why would we vaccinate against one form of a cold, and not against another form? So you went back to the same thing. What are people getting at with vaccinating pregnant women, women of childbearing potential, and children? You know what I think? It doesn't sound good as a bad word, but it looks like they're using them as human shields. They're trying to actually vaccinate young people to somehow protect older people. And I think it's wrong. It doesn't feel right. We know that these pregnant women won't be helped. They're going to be harmed. The babies are potentially going to be harmed if the data suggests from that Shimbaruku paper that there's a high fetal loss rate. We're talking about unnecessary miscarriages, loss of human life, and for children, we know it's off limits, and the FDA has told us that. The FDA has official warnings on Pfizer and Moderna. Do not use in children because of the risk of myocarditis. This can't be any more clear to mothers. In June of 2021, the CDC and FDA reviewed 200 cases of myocarditis. This is serious heart inflammation. It causes chest pain, signs and symptoms of heart failure, dramatic EKG changes, very high cardiac troponin, the blood test for heart injury, far higher than a heart attack, far higher than we ever see troponins in patients with COVID-19 in the hospital, respiratory illness. So we know the vaccine is really kind of a violent cardiac injury syndrome. 90% of these kids are hospitalized. And so I was on the national news in June. I said, wait a minute, this looks like this is the tip of the iceberg, and it looks serious, very important. And I was right. So as we sit here today, we now have the most recent vaccine adverse event reporting system data, and it's just come in for the week ending December 3rd. And you'll be shocked to learn that the CDC now has verified 16,918 cases of myopericarditis. We anticipate, in an analysis by Rose and myself published in Current Problems in Cardiology, we anticipate that the peak is around age 17, but the tail goes all the way out to age 50. And men predominate. Pretty much about 90% of the cases are men. So here we have it. We have a large number of young individuals, and I'm talking 16,000 is large. In the prior studies of myocarditis, it'd be just a handful of cases. We should only have about 300 background cases per year of myocarditis due to parvovirus, or sometimes it's idiopathic. But we're sitting on 16,000 injured young people, seriously injured young people with the COVID-19 vaccines, where they have no opportunity for benefit, and they obviously are incurring great harm.